What do men lie about the most or hide about the most when it comes to their sex life? Is it performance, desire, satisfaction? What is it?
A virgin guy who has never experienced sex in his life, whatever he has seen with the help of magazines or blue films, and he's comparing his organs or his private parts with the things which he has seen on screen or on his cell phone. There is a misconception that men only feel orgasm when they ejaculate. For a man who knows how to control his ejaculation, may experience 4 to 5 orgasms before he actually ejaculates. So there are multiple products available in the market. There are climax delay sprays, there are climax delay creams, and there are climax delay condoms. So basically people are unaware that there are also medicated products available over the counter which they can use, which can be useful, because these sprays and these condoms mostly they will contain some amount of alcohol to increase their shelf life. What will happen if you go into a NoFap mode for a long duration of time? Now that is also a strong misconception which has been spread online about the NoFap technique. In this industry, the way these films or these clips are being made, most of the men are enhanced. They are enhanced because they have undergone some plastic surgeries, like they have undergone penile implants.
So when we say male hormones, what are we talking about beyond testosterone?
The quality of the sperms in a man when he is 20-year-old or 30-year-old is very different from the quality of a 35 or a 40-year-old man. Just like females undergo a condition which is called as menopause, after a certain period of time, generally at 42 or 45, a man will never undergo andropause. Until a man is alive, he will keep on producing sperms. They are surrounded by multiple electronic gadgets like laptops as well as Wi-Fi radiation. So the radiation from a laptop or the heat which is transferred to the body if the laptop is kept upon the legs and it is being worked on, and also the non-ionizing radiation from the Wi-Fi, all can lead to low sperm count.
In this episode of The Foggy Mirror, we sit down with Dr. Satyajeet Pattnaik, a urologist and a sexual health expert, to break down something most men struggle with but rarely talk about. From erectile dysfunction and premature ejaculation to low libido, testosterone issues, urinary infections, and even modern treatments like penile implants. In this episode, we decode what's normal, what's not, and what can actually be done. This is not just about sex, it's about confidence, identity, and health. Don't just watch, subscribe to The Foggy Mirror and see what most people miss. So let's begin the episode. Great to have you on the show, Dr. Satyajeet.
Yeah, hello.
So my first question is, in your experience, what do men lie about the most or hide about the most when it comes to their sex life? Is it performance, desire, satisfaction? What is it?
Okay, so let me just brief you, because we are into this field since many years, almost 15 years right now, me and my team, and I have definitely seen a paradigm shift after the COVID pandemic. The COVID pandemic happened, then the lockdown happened. Then what happened is that, many men got lots of time to reflect upon themselves or to reflect upon their personal health, their personal lives, and they started finding out more couple time. In our busy schedule, we tend to be busy with work, with office. But during the lockdown, what happened is that the couple, they came together. So they started exploring, they started telling each other, being open with each other regarding their, preferences and regarding their moods and regarding their expectations. The couple expectations, were very open with each other. So especially after this pandemic, also due to the rise in the consultation services, which is the online consultation with the doctors. So many men have opened up. And they are also well read. They educate themselves online, especially with the help of multiple peer reviewed articles like PubMed. They do a PubMed search or they do a Google Scholar search. They review the different articles and they are almost 60 to 70% aware what is happening with their bodies, and then they come for consultation. Earlier, men, they refused that they are having some issues like their libido or their sex drive is low or their performance is low or they are not able to satisfy their spouse. They used to hide it from us, or it used to take me around 2 to 3 consultations for the man to open up. But now, fortunately, because of the rise of digital awareness, many men are aware of the basically insecurities of their body, or they are aware of the deficiencies and they are very open to us. So this happened in multiple phases. What I saw is that immediately after the pandemic stopped or after the lockdown was released, when men used to come to me, especially before their wedding, or a married man about 15 to 20 years into the relationship, and now he's facing some issues in his sex life. So they used to come and they used to, use some different names. They used to use dummy names. They never revealed their identity. Secondly, they used to wear masks. They used to, hide their face and come. And this has completely changed. Men are more open towards, having a consultation with an andrologist or a men's health specialist. And this is definitely taking the society towards a positive side. One more thing I've noticed, initially men used to come alone and they just maintained a digital copy of their documents. They used to leave their file within the clinic or within the hospital. And they used to never inform their spouse that they have come for a doctor's checkup. But now, because of the increasing awareness and relatively, the digital normalization of the society, I'm very happy to see that men are coming with their partners. Men are coming with their partners, and earlier when they used to come, they used to ask their wife to leave the room whenever, they used to discuss with me. But now, both the man and the woman, like the boyfriend and the girlfriend or the husband and the wife, they are sitting together and they are discussing, which is a very positive track towards the society.
Yeah. And what are the top 2 or 3 common conditions or diseases that you see these days?
Yeah. So the number one is misconception. Number one is misconception, which mostly happens in the age group of 18 to 23 years, 18 to 23 or 24, where, a guy who is basically studying in a hostel or he's living along with his friends, relatively unmarried and mostly a virgin guy who has never experienced sex in his life. Whatever he has seen with the help of magazines or blue films. And he's comparing his organs or his private parts with the things which he has seen on screen or on his cell phone. So basically, misconception that his penis is small or his penis is very thin. Or a very general misconception that, I have enjoyed a lot in my teenagers when I was 15, 16. I used to masturbate a lot. And after masturbation, the size of my penis became small. Is a very common misconception, which is absolutely wrong. Secondly, the semen quality or the thickness of the semen, it has become very thin. Or they say that मेरा semen बहुत पतला हो गया है क्योंकि मैंने जवानी में बहुत masturbate किया है. Again, that is a very common misconception.
There's a very shame and guilt around masturbation.
Yes, there's lots of shame and guilt around masturbation because mostly, this can arise because of childhood trauma. Okay, childhood trauma plays a major role because we find many instances where, a young boy, for example, let me tell you all that, nocturnal emission, nightfall, what we say, it can happen in men or in boys as early as 13-year-old or 14-year-old. So, history of nightfall, and the mother scolding the child and punishing the child that why did the nightfall happen. Unfortunately, this happens in many educated families also. Okay, and in many big towns also. It's not a small town thing, it happens in big towns also. Secondly, because of lack of privacy, because we live in the urban jungle where, the apartment size is small, and sometimes, a guy being caught by, the housemaid or the parents masturbating, and that psychological trauma remains behind. So there is a guilt with ejaculation, there is a guilt with masturbation. Thirdly, many misconceptions, because one thing which is freely circulated in India is advice. There are many advisors, may it be your uncle or may it be your friend or your distant neighbor. So basically they give lots of gyan to boys that, if you masturbate, what will happen is that your energy will be lost, your bones will become weak. You'll develop spectacles. Your eyes, eyesight will suffer.
Skin, acne.
So basically, these are misconceptions. And this leads to a condition which is called as post-orgasmic depression syndrome. Post-orgasmic depression syndrome is not only found in females, but it is also found in men. Okay, so the moment they orgasm, they feel that their energy levels has gone down, and they feel very low. and they feel as if a certain amount of energy has been taken out of their body. These are all misconceptions, and this can be easily treated with the help of a psychological counselor. And so post-orgasmic depression syndrome can be easily treated with just counseling. Not even, no medications are required for this treatment.
But what about frequent masturbation when someone is addicted? Does it
Yeah.
really lead to ED?
Yeah. No. Frequent masturbation, see, because we have to understand the science behind erection, the science behind getting turned on or libido, and also the science, how does the body recover after you ejaculate. So basically, erection or libido, it happens at the level of the brain. There are certain parts of the brain which are responsible for a man or a boy being, sexually stimulated or sexually aroused. It can happen, in young boys. It may happen, when they see a female colleague or a female student or even, a neighbor, and they may keep on imagining about it. And, initially it starts as nightfall, and then, they learn about masturbation somewhere, or they explore themselves while taking a shower, and the feeling of ejaculation gives them lots of pleasure. It is basically the dopamine effect. Okay, so they get addicted to this, short instant pleasure or instant burst of dopamine, because of which whatever free time they find, maybe in the summer vacation or evening when they come back from school or come back from college, they start masturbating. Okay, so, and this can be also, a reason of low confidence or lack of confidence in the boy or in the man. For example, a boy is growing up, he's 16 or 17 years old. Maybe he likes someone or he likes a girl. So he's not able to approach that person, but somehow he finds a picture of that person on Facebook or some social media. And just to, take care of his insecurities, he's having a look at that picture and he's masturbating. Or he's fascinated about a celebrity. He's taking the picture of that person and he's masturbating. Now, all this comes under child psychology. Or this requires certain kind of a psychological counseling. That your real life is outside the room. It is not inside the room. And just to, take care of your insecurities, you're masturbating. So basically, when a person ejaculates, the ejaculate volume is 2 to 2.5 ml. And every ml of semen will contain millions of sperms. So let me tell you that to form a quantity of 1.5 to 2 ml of sperms, or the sperms to mature, your body requires 72 days. Your body requires 72 days, and to completely recover and replenish the amount of the ejaculate, it will take at least 48 to 72 hours to completely replace it. Okay, so frequent ejaculation may cause some amount of weakness. If the child is having a healthy diet which is rich in micronutrients like zinc, selenium, vitamin C, vitamin E, mostly he will not suffer from any complications. But if a undernourished person or a person who is habituated to eating lots of unhealthy food, junk food, and is not getting enough micronutrients, then he may experience some amount of physical weakness. Also, the volume of ejaculate which comes out, it is from 3 organs. So the major bulk of the seminal fluid, which is the sticky substance, it comes from the seminal vesicles. Seminal vesicles, which are 2 glands. Secondly, it contains some of the prostatic secretion, and it will also include the sperms from the vas deferens or the testicles. So basically 3 organs come into play and you ejaculate. So basically, how often should a boy or a man ejaculate? Now we have discussed, masturbation addiction. Now let us also discuss, what will happen if you go into a NoFap mode for a long duration of time. Now that is also a strong misconception which has been spread online about the NoFap technique. So NoFap basically preserving the sperm or preserving the semen. Let me explain you the physiology or what the actual medical field says about it. So just like females undergo a condition which is called as menopause, after a certain period of time, generally at 42 or 45, a man will never undergo andropause. Until a man is alive, he will keep on producing sperms in his body. So the sperm production continues, although the quality, the number as well as the motility of the sperm may decrease after a certain age. But continuously the production of seminal fluid and the sperms keeps taking place, and at least once a week the man has to ejaculate. At least once a week, which is at least 4 to 5 times a month, you should ejaculate.
Basic recommendation.
Recommendation, because if you don't ejaculate, what will happen is that the pent up seminal secretions or the pent up ejaculate, it can cause a condition called chronic prostatitis. The prostate, which is a reproductive organ, which is situated at the base of the bladder or just around the bladder neck, it secretes fluid, which is the prostatic fluid, which is rich in fructose. It is responsible for the nutrition or the nourishment of the sperms and also for the health of the reproductive tract. If you don't ejaculate, the ducts of the prostatic vesicles or the ejaculatory duct may get blocked with the help of thick secretions, the thick seminal secretions, and these secretions instead of coming out are inspissated, which is they re-enter and which may cause growth of some bacteria and cause bacterial prostatitis, or it may cause non-bacterial prostatitis. Okay, so initially this was seen in men who were away from their family for a long time, like sailors, or this used to be seen in prisoners who were in prison and they had no other means to ejaculate. So basically a chronic non-fap technique, because I do receive many teenagers, many boys, also many grown-up men who tell me that 3 months, 4 months they haven't ejaculated. So this can turn out to be a health hazard if you don't ejaculate frequently. So excessive masturbation can also cause nutritional deficiencies, and it can also damage you on a psychological point of view. Whereas the chronic NoFap technique, what it will do is that it may cause some health issues like chronic prostatitis. It can also cause repeated urinary tract infections. Okay, and when we come to excessive masturbation, one thing or one major complication which it can cause is that it can basically lead to premature ejaculation. See, because when a guy is alone or when a boy is alone, he is stimulating himself and he is ejaculating. So basically the latency time or the time to ejaculate is less, because his main intention is to ejaculate and pleasure himself.
Yeah.
But when a man is with his woman or when a couple is together, that time what happens is that you have to consider your pleasure as well as the pleasure of your partner.
Yeah. Absolutely.
So many times, we may see a condition called PME or premature ejaculation, which is a man may ejaculate before penetration during the time of foreplay, or a man may ejaculate within 1 minute of penetration, which is called as low intravaginal latency time.
Is it because of anxiety, performance anxiety?
Yes, it is because of anxiety, performance anxiety. It can be because of past traumatic experiences, relationship with, or some experience with a friend or a girlfriend, that some negative comments have been passed that you ejaculate very fast, you are not able to pleasure me. So those past thoughts may keep on running in his mind, and this may either lead to early loss of erection without ejaculation, that very early he'll be disinterested in sex because he'll be continuously under the pressure of performing for a long duration of time, or it may cause fast ejaculation or premature ejaculation.
What are some effective ways to delay climax?
Yeah, so basically we have to understand that man or humans are the only animal species who perform sex for pleasure. Every other species just performs sex for reproduction, but man is the only species which performs sex for pleasure as well as for reproduction. So it is a pleasurable experience. It cannot happen under pressure. Okay, so if a man is continuously under anxiety, under pressure to perform, he will not be able to perform well. So relaxation is very important. Here, the condition which we discuss is the couple compatibility. Okay, the couple should be compatible with each other. Understanding between the couple should be nice. There should be a good privacy, and there should be no pressure involved from either of them. Okay, then a man will be able to perform better. Also, the couples need to give adequate amount of time to each other. For example, this goes for both the men as well as women. So females need to understand that a guy needs to relax to perform well. At the same time, the man needs to understand the pleasure points of the female or how to satisfy his wife, they need to talk openly. And even if, sometime, like the starting of the marriage or the initiation of the marriage, the females are little bit skeptical or they are little bit afraid for penetration, then the man should be, willing enough to give some time to his spouse so that she is ready for a good sex life.
Are there certain sex positions that helps in delaying?
Definitely there are. So, sex has got multiple levels or multiple phases. Although, human beings, we are basically, we pleasure each other, we pleasure ourselves. So there is no textbook rule that these steps need to be followed. But in general, for beginners, if they follow these steps, then definitely they'll have a more pleasurable and a stress-free sex life. So initially, it has to be privacy. The couples, they need privacy. So there should be no this thing, fear among them that someone may knock on the door, or maybe someone may peep through the window. So this factor should be out of the picture. Secondly, it has to start with foreplay. It has to start with foreplay for both the male partner stimulating the female partner as well as the female stimulating the male partner. Okay, and once the foreplay is good, or once the foreplay is achieved, for example, for men to get into libido mode, it takes a shorter amount of time. For females, it takes some time. Generally, a female is ready for intercourse when she is stimulated or the vaginal fluid secretion starts or the wetness starts. So a man has to take care of the partner. He has to have a good foreplay until the vaginal lubrication takes place. Then comes the point of penetration. During penetration or before penetration, for young couples, definitely I give them the option, or I recommend them that they use a proper lubricant. If they use a proper lubricant, the entry will be smooth. Also, the friction during the entry may cause early ejaculation for men. Because the glans is sensitive, because you are not used to have intercourse. And if you use a lubrication or a glide gel, the most commonly found is the sterile KY jelly. KY jelly or Lubic jelly, which is easily available over the counter. You can use it. You can apply it for your partner. You can apply yourself. And secondly, use protection. Initially, when you're not confident of, lasting long, or you're not confident that, you don't know the partner, or you're just experimenting with each other, you should use protection. So put on a condom, put on some jelly for yourself as well as your partner, and then you can start. So the commonest position which can help in delaying ejaculation is standing missionary position. Standing missionary position, which should be the first position I recommend for any couples who are planning to, have intercourse or start consensual sexual activity for adults. So
standing in the sense because
standing
the
missionary, for
blood
example,
flow would be
the woman,
throughout.
Yeah.
The body.
So the lady is basically lying down on the bed, and there are basically 1 or 2 pillows kept below the buttocks so as to elevate the pelvis. Okay. So, and this is very important because the entry or the insertion is at 45 degrees angle. It is not horizontal. It is at 45 degrees angle. So this will facilitate easier penetration as well as deeper penetration by the male partner. And you can keep on changing positions. You can keep on changing positions if you feel you're about to ejaculate in some time. Changing the position or switching between intercourse to foreplay and foreplay to intercourse will definitely ensure that you are having a good couple time together. And this brings us to a very important question, that how much is the average duration of intercourse, or how much should be the timing. As we discussed earlier, ejaculation before penetration or ejaculation within 1 minute is premature ejaculation. Okay, if a couple is able to penetrate after foreplay and the penetration lasts for about 10 to 15 minutes, then it is the ideal time. For a healthy couple, 10 to 15 minutes of good penetration, I would call it healthy sex. Many misconceptions.
That includes foreplay or only
excluding foreplay. So, if you include foreplay, it will be a very pleasurable experience. For example, 15 minutes of foreplay followed by 10 to 15 minutes of penetration, which will be a very pleasurable experience for the couple. And foreplay will also help you in relieving stress as well as getting ready for the intercourse, because foreplay will release a hormone in your body which is called as oxytocin or the cuddle hormone. And oxytocin is the hormone which will reduce the stress. It is protective for the cardiovascular system for both men as well as women. And it will also relieve your anxiety. So you will be more relaxed for intercourse.
Climax delay condoms are everywhere these days.
Yeah.
So
there are multiple products. There are multiple products available in the market. There are climax delay sprays. There are climax delay creams. And there are climax delay condoms. So basically, people are unaware that there are also medicated products available over the counter which they can use, which can be useful. Because these sprays and these condoms, mostly they will contain some amount of alcohol to increase their shelf life. Or some amount of ethanol.
They might cause irritation.
They might cause irritation for you as well as your partner. So I would recommend some very simple creams like Lox Gel. Lox Gel 2%. You can
These
apply.
are
A man
over
can
the
apply,
counter?
and where to apply also guys don't know. So let me explain you. For example, the undersurface of the penis. The undersurface where you can see the attachment of the skin or the frenulum. That is the area where most of the nerves they converge, and stimulation of that point may cause fast ejaculation. So what you can do? You can use 2% Lox Gel, or you can use Prelox Gel or Prelox ointment on that area for some time, and just apply it for 15 minutes and 10 minutes before intercourse you wash off that area.
Okay.
So early ejaculation will also, be prevented. Secondly, after using this gel, if you use a condom, then your duration will increase. The duration will increase. So if you're doing it with your spouse for the first time, apply some Lox Gel or some Prelox Gel. The contents we can display it in the subtitles so that they can easily avail it. Then they can put on a condom. After washing out the gel, start stroking slowly, and then as you gain confidence, have deeper strokes. And before penetration, use a generous amount of lubrication. And once you're confident enough, then that time you can remove the condom, use little bit more lubrication, and then continue.
And do Kegel exercises improves erection and quality?
100%. So Kegel exercises we do recommend for both men as well as women. Now what will happen to men who are regularly doing Kegel exercise for 4 to 6 weeks? In 4 to 6 weeks duration, they will be conscious about the contractions of the pelvic floor. The pelvic floor is made up of multiple muscles, including the levator ani, bulbospongiosus, bulbourethralis. So basically, it is a floor on which your bladder and your reproductive organs are resting. If you control your pelvic floor, then definitely you can delay ejaculation. You can consciously delay ejaculation, as well as for your erections. There will be definite improvement if you do regular Kegel exercises. For females, if they do regular Kegel exercises, then what will happen is that the tone of their vagina will improve, as well as their vaginal contractions or the vaginal orgasm will be better. Females have primarily 2 types of orgasms. One is the clitoral orgasm, which is achieved by stimulation of the clitoris, and the vaginal orgasm or the cervical orgasm, which is the deeper orgasm which they feel. They may feel it as a sense of vibration. And then there is a complex orgasm, which is the combination of clitoral as well as vaginal orgasm. So these orgasms will be more intense if they train their pelvic floor.
Is it the G spot that they speak about?
Yes.
And
So
they use vibrators for that as well.
Yeah. So the G spot is basically located deep within the vagina. There is also a O spot, which is located within the perineum. So this what we discussed, so initially foreplay, adequate lubrication, using a lubricating jelly, deeper penetration, keep on changing positions. This will make sure that, the female receives the clitoral as well as the vaginal orgasm, which will be a more complete experience.
Got it. So what are some early warnings?
As well as for men,
Okay.
if they try to control their ejaculation or they achieve control over their ejaculation, a man can experience multiple orgasms
Like?
until he ejaculates. So there is a misconception that men only feel orgasm when they ejaculate. For a man who knows how to control his ejaculation, may experience 4 to 5 orgasms before he actually ejaculates.
Never heard of this.
Yeah.
So are there some early warning signs of erectile dysfunction that men should be aware of?
Yeah, early warning signs in general, erection basically is a reflection of your complete health. Okay, so erection is basically a vascular phenomenon. It's a neurovascular phenomenon. So why does erection happen? Because see, certain areas in the brain get stimulated. Certain endorphins and certain hormones are released. The primary being testosterone and dihydrotestosterone. Then there is an increase in the blood supply to the penis, which is a parasympathetic activity. Your parasympathetic nervous system gets involved. There is the filling of blood into the cavernosal spaces, and then you receive a full erection. Okay, so blood vessels are involved. The diameter of the blood vessels is important because the blood vessels will pump blood into the penis. At the same time, the nerves are also important because they will help in the relaxation or the vasodilatation of the cavernous spaces. More the amount of blood flow, the more better will be the erection. Then ejaculation or ejaculating is a sympathetic activity. So the sympathetic nervous system comes into play and you ejaculate, and after ejaculation the erection goes down. Okay, so nerves, the quality of the performance of the nerves as well as the blood vessels as well as the hormones in your body is very important. Now, what conditions may cause poor erections? Number one is diabetes. And India has now become the diabetic capital of the world. And there are also many youngsters who are developing pre-diabetes. Now, this is all because of sedentary lifestyle, lack of movement, using lots of processed food or unhealthy food, as well as genetic predictors. For example, if you have got a family history of diabetes, you should be careful. You should do regular physical activity like walking. You should have a healthy diet, and you should have a very conscious lifestyle. Secondly, high blood pressure or hypertension. High blood pressure or hypertension, the people who are on antihypertensives, one of the side effects of the antihypertensive pills is weak erections. Thirdly, the people who are suffering from dyslipidemia or they have some anomalies in the cholesterol levels, they are basically on pills which we call statins. Now these statins, they may indirectly lower the testosterone level, they may lower the libido, and indirectly they may cause poor erections. The reason being, testosterone is a product of cholesterol. Testosterone is the hormone which is made because of cholesterol metabolism in the body. So if you're taking some drug to lower the cholesterol, it may indirectly affect your testosterone levels. Fourthly, neurogenic disorders like, people who are suffering from nerve degeneration disorders, or individuals who have undergone some spine surgery, or individuals who have undergone some prostate surgery, where or a major pelvic surgery has been performed. Some cancer surgeries have been performed and the nerves have been damaged. Definitely it may cause neurogenic erectile dysfunction. So these were the physical causes of erectile dysfunction. So now, since we have discussed the physical forms or the physical causes of erectile dysfunction like vasculogenic, neurogenic, as well as the hormonal causes, as well as the pills or the tablets which can cause erectile dysfunction, let us concentrate on the more important part which is seen nowadays is the psychogenic erectile dysfunction. Now, ED or erectile dysfunction also has got a psychogenic factor. So, and this can be treated, and the major treatment of psychogenic ED is counseling.
It's more of a psychosexual subject as they
Yes,
call it.
exactly. So here, it can be caused because of fear of ejaculation in men suffering from post-orgasmic depression syndrome, or it can be performance anxiety. Is that if I initiate an act of sexually pleasuring my partner, and what if I fail, and what if I'm not able to meet her expectations, then what kind of comments will be passed against me? This is also one of the major causes of ED or performance anxiety, which men often they don't share with their partners. So, and you don't need to go to a psychologist or a psychiatrist for this. Your partner herself can counsel you. Your partner herself can counsel you, and we do encourage, transparency between the couple.
So seems men today are more overstimulated and under experienced.
Exactly.
And that also this porn induced ED.
Exactly.
There.
So see, because pornography is a industry which is flourishing. It is a multi-billion-dollar industry, and unfortunately, many men as well as women, they are habituated to see pornographic movies as young as 14 years of age. So we have boys as well as girls in our community who are addicted or who are habituated to see pornography, and they perform and performing masturbation while watching a pornographic movie is the easiest way to pleasure themselves because of the dopamine release and the instant gratification or the instant pleasure which they get. So basically, in this industry, the way these films or these clips are being made, most of the men are enhanced. They are enhanced because they have undergone some plastic surgeries, like they have undergone penile implants, so as to magnify the size of their private parts. Secondly, these movies are shot over a period of weeks to months, and they are edited, and these edited clips are they are joined together. So it feels like continuously the intercourse is going on for hours together, whereas there are multiple short takes which are then joined together. So this misconception is basically should be taken care of, and men and women as well as boys and girls should realize that this is not real life, whatever they see in these movies.
You spoke about diabetes, so let's talk about that. Many men with diabetes don't even realize there are conditions like phimosis, balanitis, which are basically hygiene related issues. So how common are these?
So basically, see, diabetes, as we discussed, that India is now the diabetes capital of the world. There are many diabetic individuals, both men and women, in different phases of life. There is juvenile diabetes, which is also rising in India, which is happening in teenagers, or type 2 diabetes is also happening earlier in Indian men and women as compared to the Western population. Now this is because majority of the Indian diet is a carbohydrate dominant diet. Secondly, we are also genetically susceptible to diabetes. The Indian genetics is genetically susceptible to diabetes, and we are a race which has kept on moving or kept on doing some kind of physical work. So the recent corporate culture, which we also called as the office syndrome, where there is sedentary lifestyle, individuals are sitting around majority of the parts of the day. Even to commute from one point to the other, we need a cab, or we are just sitting throughout the day. There is no level of physical activity. Now this will cause insulin resistance. Insulin, which is the hormone present in body responsible for glucose metabolisms or to drive the glucose into your cells, your receptors will become resistant to this hormone, and eventually the levels of insulin will lower in your body, and your blood sugar levels will rise, and an individual will develop diabetes. So diabetes, I say, is a multi-organ disease. It is not just increase in the blood sugar level, it is a multi-organ disease, or I would like to say that in medical terms that this disease causes microvascular neuropathy. Number one, it will reduce the diameter of the blood vessels. The quality of the blood supply to the private parts will reduce. Secondary, it will cause neuropathy, which is the nerves, the lining of the nerves will be damaged, and the functioning of the nerves will be damaged. So definitely it is one of the major causes of low libido as well as erectile dysfunction. So diabetes, again, because penis is a peripheral organ. What are peripheral organs? The organs where the diameter of blood vessels keeps on reducing. So majorly the blood vessels, they start from the heart, and then they branch out and they go to the periphery. So when they reach the tips of the fingers or the tips of the toes or the penis, which is a peripheral organ, and the foreskin, which is on the top of the penis, because of the reduced blood supply as well as reduced immunity of the diabetic individual, because diabetes also affects your immunity. Diabetic individual may land up with a condition called as balanoprosthitis, or inflammation of the glans penis as well as the prepuce. Okay. Now balanoprosthitis can also be a reason of some diabetic medications or some oral hypoglycemic agents like metformin and Janomet. Now what these medications do is a very complex study, but 6 out of 10 individuals consuming these medications develop balanoprosthitis. There are multiple theories behind it. The number one theory is that most of the sugar which leaves the body is through the urine. And that's the reason why the immunity of your reproductive tract reduces. One more theory is microvascular neuropathy, which is the blood supply to the peripheral organs reduces, and as a result of which you develop this chronic balanoprosthitis. So what happens in this is that the prepuce or the foreskin becomes inflamed. Every attempt to pull back the foreskin, you will develop some red cuts And when these cuts heal, the foreskin becomes even more tighter. So every attempt to pull back the foreskin while taking a shower, while cleaning, or while having intercourse will cause pain, will cause discomfort. It can cause premature ejaculation. It can cause built-up of infected material below the foreskin, which we call smegma. And it can also cause repeated urinary tract infections. Okay, so definitely this has to be addressed. And once an individual develops balanoprostatitis, he has to be properly evaluated. We have to do a urine test, including a urine routine microscopy, culture sensitivity. His blood sugar levels need to be checked. And if this condition is not settling with the help of the basic antibiotics as well as the basic lubricating creams which we provide, then circumcision is the best option. One more thing, many individuals and many non-medical professionals, they are prescribing steroid creams for melanoprostatitis. Now this should be a strict contraindication, because steroids will give you temporary relief and they are not the cure. They are just a temporary fix. They are not the cure. And many individuals are using this over-the-counter creams for years and years together. And by the time the person lands up with us, the local area is completely infected and with multiple adhesions. So the circumcision procedure, which could have been a very simple case, it will be a complex surgery and the healing will definitely take a longer time.
Yeah, circumcision is a better and I think the cure for these conditions.
So it is not the first line of treatment. The first line of treatment is to visit a urologist or an andrologist who will check you completely, who will assess, the condition, and then he will prescribe.
There is also another condition called as Peyronie's disease, which causes that abnormal curve of your penis.
Yeah. So Peyronie's disease per se has got nothing to do with diabetes. It can happen in diabetic individuals, but Peyronie's disease is basically a plaque or a localized fibrosis within the penis or within the shaft of the penis, which causes abnormal curvature of the penis. This is a very important point, because many young boys and many young men come to me and they tell me that my penis is not straight. It is diverted to one side. Also during intercourse, when erection happens, it gets diverted to one side. So I tell them that it's absolutely normal. If you are able to achieve penetration, there is no human being born on this earth with a penis which is completely straight. It will be diverted either to the left hand side or to the right hand side. And minor curvature during erection is also very common. When does the problem start? The problem starts when the plaque or the dense tissue which is over the penis, it starts paining, or it is painful, especially pain during intercourse or pain during handling the penis. Also the curvature of the penis, if it is more than 30 degrees, then it is a concern. Then you definitely require some treatment. And if the curvature is so much that penetration is difficult or penetration is painful for the couple, then definitely you need treatment. So Peyronie's disease, definitely lots of research papers have been published and lots of treatment options have been available. Now there are some non-invasive approaches like the penile straightening or the penile traction devices. Traditionally these devices were very popular in the late 80s, and recently also once again a research has started. So these devices, basically they have a traction like hook or a cuff on the penis, and then the penis is strapped to the thigh on one side to keep the penis straight. Now they have got no clinically proven efficacy, although definitely when it is used it is harmless, but the efficacy is definitely questionable. Second option before surgery is definitely some topical injections. Topical injections like calcium channel blockers like verapamil into the Peyronie's plaque can be given, which may help in softening of the plaque and relaxation. Thirdly, Botox injection into the plaque. It is the latest advancement, and it should be done only by a urologist or an andrologist, and it is an image guided procedure. So basically this procedure is done under ultrasound guidance. It is done under the use of high frequency ultrasound guidance, and we localize the plaque and we inject botulinum toxin or Botox, Onabot A or botulinum toxin A into the plaque. And the dose of the Botox injection, it depends upon the size of the plaque, the condition of the individual, as well as the general condition of the patient. Okay, so these injectable medications have got limited efficacy. They may completely dissolve a small plaque, or they may partially dissolve a plaque which is standing for a long time, or the patient may not have any effect. Okay, so these are the limitations. Third one, which is the most common option for Peyronie's disease is a microsurgery or a microscopic surgical procedure which will be performed by a andrologist to straighten the curvature. So in this procedure, the plaque is excised. The surgery is done under microscope so as to preserve the blood vessels and the nerves supplying the penis. Once the plaque is excised, the defect within the penis is repaired. And if the doctor feels that after this surgery there may be some problems in erection, then the patient is counseled pre-operatively about a penile implant. So patient counseling is very important. Explaining the patient the pros and cons of the surgery is very important. And the patient should be open-minded that after the surgery he may develop some weakness in the erections. And to counter these weaknesses, if the person is willing for an implant or a penile implant, then it is the decision of the person. So, an informed surgical procedure is what is recommended.
Sounds very painful, and the post-recovery must be very slow
Post-recovery,
as well.
no, it is not at all painful.
No?
And generally men recover within 1 week. Within 1 week, the regular activity starts, and sexual activity can commence 3 to 4 weeks after the procedure. So a month's rest is required after the procedure, after which the man can perform all activities.
So when we say male hormones, what are we talking about beyond testosterone?
Yeah, so basically men, the entire seat of hormones is the brain. The entire seat of hormones is the brain, and the testes are the major organs which produce testosterone. Although there are different organs in the body like the adrenal glands which are above the kidney, they also produce testosterone. But the major amount of testosterone in a male is produced by the testicles. So basically the brain is like the CEO or the commanding officer which releases GnRH, which is gonadotropin releasing hormone. It also releases luteinizing hormone or LH and follicle stimulating hormone or FSH. Now these hormones have an impact upon the testicles. They have the impact such as they promote the testicles to produce the sperms also, or the spermatogenesis. As we discussed, the life cycle of a sperm to maturity is about 72 days. So LH and FSH, they help in the production of the sperms. They will also stimulate certain cells within the testes to produce testosterone hormone. Now once testosterone is formed, there is not one type of testosterone in the body. There are multiple forms of testosterone, like the free testosterone. And once the testosterone is formed, it gets activated in the body to DHT or dihydrotestosterone, which is the more powerful form of testosterone, which acts upon the genitals, it acts upon the entire body, and it produces masculine features. So these changes, they take place in the lifespan of a male. When a man hits puberty by 15 or 16, the voice changes, he develops facial hair, and the orientation towards the opposite sex changes, as well as he develops some body hair, muscular features. Now everything which we call, puberty is basically a role play of testosterone as well as DHT in the body.
TRT is also becoming very popular
Yes.
these days.
Yes.
Why do people do that?
Yeah, definitely. So TRT, earlier it used to be a controversial topic in our country because testosterone abuse was common, especially among the gym going athletes as well as the sportsmen. But now controlled TRT or TRT under supervision is legal in our country if it is given by a board certified urologist, andrologist or endocrinologist. So these are the doctors who are responsible for monitoring the patient, checking the reports, and giving a customized testosterone replacement therapy in a safe way. Now to whom TRT can be given? This is a major question. So TRT we have given, as a urologist and an andrologist, we have given TRTs to young boys with delayed puberty. Young boys with delayed puberty, or adolescent boys, or young boys who have a micropenis. Micropenis is defined as the shaft length of the penis is less than 2.5 centimeter when it is stretched, or the stretched penile length being less than 2.5 centimeters, that is defined as micropenis. So to promote the growth. Thirdly, it has been also given to the aging male, especially after 40 years of age. As a man ages, he loses muscle mass, he loses bone density, and in general, the libido is also lost. So for men also we have given testosterone, but we need to monitor multiple variables before we customize a testosterone plan or a TRT plan for the man. First of all, we have to check the complete blood count. We have to check his hemoglobin level. We have to check the hematocrit or the thickness of the blood. Secondly, we have to check the lipid profile of the man, the cholesterol levels. We have to do a complete examination of the prostate gland. We have to check his PSA level. We have to ask for family history of prostate cancer or BPH. We have to measure the size of the prostate. As well as we have to ask them certain very important questions regarding their cardiac health, regarding their vitality, their expectations from the therapy, and then a custom dose is made.
So what are different forms of this TRT for aging men, like 40, 50 plus?
Yeah. So we were often fascinated when we used to travel abroad or we attended conferences abroad, because United States is the first country which legalized ethical testosterone supplementation or ethical hormone replacement therapy for men. So basically, in states, multiple devices are available. For example, testosterone gels, testosterone creams, and testosterone pellets, which are testosterone implants for men, testosterone nasal sprays, as well as different forms of injections, which are subcutaneous injections. They can be available in preloaded pens, where the man can take it subcutaneously or below the skin of the abdomen.
But these men are over the counter?
Not over the counter. No. You have to have
recommendations
be checked by a board certified urologist or andrologist or an endocrinologist, and they have to prescribe you. So a weekly supply is over, then again you have to get yourself checked and you get the supplies. So fortunately in India now, we have testosterone gels, we have testosterone tablets, we have testosterone implants or testosterone pellets, and we do have multiple different types of injections with multiple half-lives. Now, whenever we talk about a hormone, the T-half or the half-life is very important. And with the help of this multiple agents, we can have a customized approach to every person. So initially, always we start with the lowest dose. After making sure that the person or the individual is completely risk-free, and he doesn't have any risk of any cardiac events, he doesn't have any risk of any hormonal events, he is not a stroke patient, and he also doesn't have any risk of prostate cancer. Then we customize a plan for the man, and initial therapy will always include the salts of testosterone with the lowest dose. So testosterone has got different salts. Before starting TRT therapy, I generally put my patients on some supplements which will naturally produce more testosterone from the testicles, which is the safest approach. The most underrated supplement in India is fenugreek seed extract, or what a layman will call methi dana extract.
Methi dana.
Extract. So this extract of the fenugreek seeds, it has got multiple benefits, like, it will improve the testosterone. Not only it raises the testosterone level, but it will also improve the testosterone sensitivity. When this fenugreek seed extract is combined with a herb called ashwagandha, then what it does is that it will also lower the blood sugar levels. It will also improve the insulin sensitivity. So diabetic men, for example, if a man is diabetic around 40 years of age, diagnosed with early diabetes with a strong family history, and he's also suffering from the early signs of andropause, which is, lowering of the muscle mass, lower energy level. He feels that he's becoming weaker, his libido is low, and the body fat percentage is increasing, especially the chest fat and the fat around the hips is increasing. Then starting off with a fenugreek seed supplement will be the safest option for him.
What are some other foods that you would recommend?
Secondly, a very powerful supplement both for erection as well as for the performance of testosterone within the body is an amino acid which we call levoarginine with citrulline. Now, L-arginine with citrulline is a very powerful combination because it improves the production of nitric oxide or NO within the blood vessels. This will be beneficial for the heart, for the skin health, as well as for the reproductive health. So any man above 40 who wants to start some natural supplements to support his reproductive life, he can start a supplement of fenugreek seed extract along with ashwagandha. Along with it, he can start levoarginine supplement. Now, levoarginine is available in multiple forms. It is available in capsules, tablets, as well as sachet. Sachet, which is the powder sachet. Now, sachet or the levoarginine powder, it has the maximum bioavailability. Now, what is bioavailability? Bioavailability is the amount of drug which enters your bloodstream once you consume it. And the sachet will have the maximum bioavailability if you take it early morning post your workout. Okay, so morning time, this is taken as a pre-workout supplement by athletes. If you take it pre-workout, the benefit is that you'll get a better pump during workout because the blood supply of the muscles, the functioning of the muscles will improve since it releases nitric oxide within the blood vessel. But many experimental studies have recently shown that if this levoarginine is taken post-workout, especially in the morning time, like after a quick morning walk or a workout session at home, then it improves selectively the blood supply to the private parts.
What are some other food that boost testosterone?
There are multiple factors. So, for example, nuts and seeds, which contain healthy fatty acids like omega-3 fatty acids, like sunflower seeds, chia seeds, also, almonds, they contain lots of omega-3. Fish oil or cod liver oil, it contains a good amount of omega-3, which can help you in normalizing your hormone levels, as well as it is very promotive towards the reproductive health of the man as well as women. Now, omega-3 is also very important for young diabetics because it will help you in achieving satiety in whatever food you eat. Because omega-3 fatty acids will stimulate the satiety center in your brain. So, even with smaller meals, you will be feeling satisfied. So, these are some basic supplements.
Can you take these omega-3 supplements over the counter?
Yes.
That's very safe.
Yes, it is very safe. Whatever supplement you take, let me tell you that these supplements need a break. Because whatever supplements you take, they are stored in the body. Water soluble vitamins like vitamin C, vitamin B12, your urine will excrete. But most of the fat soluble vitamins, vitamin A, D, E and K will be stored in the body. So what I recommend my patients is that you can take the supplements for 3 months. After every 3 months, give a gap of 15 days and then again restart. So if you're taking omega-3, you can take it for a period of 3 months. After 3 months, give a gap of 15 days and then again you can restart.
So what are some common STDs that you see in your practice these days?
STDs are common. They are common in both men as well as women. So STDs can be caused because of bacteria, viruses as well as parasites. And the common STDs which we see in our practice is it can be chlamydia, chlamydia vaginitis or chlamydia urethritis. It can be herpes, which is very common nowadays, HSV1 and as well as HSV2. It can be gonorrhea, which mostly affects the urinary tract in both men as well as women. So there are multiple STDs which we see nowadays. STDs like syphilis are very rare because of the control programs which were run by the government. And syphilis is almost extinct, especially in the Indian society. STDs like HIV, we do see, but the number is decreasing.
So are condoms fully protecting these STDs? Are they fully effective?
The safety effect of a condom, if a man uses it well, is on a scale of 1 to 10, I would rate it 7. I would rate it 7, which is, there is also a technique to use a condom. So initially, the penis has to be completely erect and the condom has to slip in properly. And once the condom is slipped in, the little bit amount of air which is in the tit of the condom or the bulb-like projection, it has to be squeezed out. It has to be squeezed out. Okay. And once the penetration starts and the intercourse starts, it is always feasible to check the condom after wearing it to make sure it is not burst. If some aggressive activity has happened and you feel that the condom has burst during activity and you have ejaculated inside, both the man and the woman at a regular window period, they can get a test done and they can also go for post-exposure prophylaxis if you don't know your partner. Okay, so multiple factors come into play. So now we can discuss about the different contraceptive methods. Okay, so for females, OC pills or oral contraceptive pills, they are a good option. Secondly, female condoms are also available, although it is very cumbersome, but there are some females who are comfortable putting it on. Men, definitely condoms are a good option. any type of condom is a good option for you. Thirdly, diaphragms, which are used by females. Basically, the use of diaphragms as well as spermicidal gels, which are used by the women, they may increase the chances of urinary tract infection among the females. So females need to be careful regarding the use. And nowadays, there are also multiple injectable contraceptives which the females can use, which have, a longer duration of protection. But at the same time, if a contraceptive has to be used, vasectomy is also an option in men. Many men, after they complete their family, they come and they want the option of vasectomy, which is extremely safe.
Is it rare or is it very common?
It is very common. It is very common. And just like a female gets a tubal ligation after she has completed her pregnancy, or she opts for it and gets it done, a man can also undergo vasectomy. And what we recommend is that up to 3 months after vasectomy, to put on a condom or use protection for before intercourse, because the semen may keep on inclusive of sperms even after vasectomy, because the amount of sperms which are in the vas deferens or the spermatic duct, they may come out and your partner may still get pregnant. So up to 3 months after your vasectomy, use a condom, use a protection. After that, get a semen analysis test done, and after that you can go ahead with regular intercourse. Okay, one major conception after vasectomy is that many men say that I will have dry orgasms, or my orgasms, the quality will reduce, or I will not produce any sperms after, or I will not produce any semen after vasectomy. This is a totally wrong concept, because earlier, as we discussed, seminal fluid or the secretions which come out when a man ejaculates is a combination of 3 types of secretions. The secretion from the seminal vesicle, which will mostly contain mucus, prostatic secretions, as well as the sperms from the testicles, which are carried by the vas deferens or the spermatic duct. Now, the sperms are the least amount of volume of the seminal secretion. So definitely after a man undergoes vasectomy and he ejaculates, so the volume of semen will be the same. Just the number of sperms will be very less, or he will not have any sperms within the semen, but the seminal fluid he will be able to produce.
So is sexual health and urinary health connected?
Definitely. Sexual health and urinary health is connected both for men as well as women, because and especially women are more prone to develop urinary tract infections after sexual intercourse. The reason being, the urethra or the tube which carries urine in females is shorter as compared to males. So easy access, the bacteria, once they enter the genital tract, they can easily access the urethra and they can enter the bladder, causing an infection called cystitis or urinary tract infection. Also in the female, the reproductive tract, the urinary tract, as well as the anus or the anal tract is very close to each other. So definitely the infection may enter, and recurrent infection is also very common. So we do recommend both men and women, especially women, to urinate after the act of intercourse, hydrate well, and clean themselves or wash themselves after the act of sexual intercourse. And for women, the habit of cleaning should be from front to behind rather than from behind to front.
This may also cause delayed fertility, these kind of infections.
Definitely. Certain sexually transmitted infections can cause delayed fertility, like syphilis, which used to cause multiple miscarriages. Fortunately, in this era of 2026, syphilis is very rare, but syphilis is one of the causes. Herpes also can cause reduced fertility or infertility. Also, repeated urinary tract infections by the bacteria called gonococcus or gonorrhea. It can also cause strictures, multiple strictures in men, which can cause reduced fertility.
So lab tests are generally recommended at a frequency kind of every month, every quarter.
Definitely. Viral markers, testing for viral markers as well as some other markers is very important. So a man or a woman who wants to be sexually active with your partner or premarital, in premarital counseling or pre-marriage counseling, we do recommend testing for HIV, for HSV 1 and 2, IgG as well as IgM. We recommend testing for hepatitis virus, which is one more sexually transmitted disease which no one talks about, but hepatitis B
Yeah, no one talks about hepatitis B.
Hepatitis B, because hepatitis B is the infectivity of hepatitis B is much more than HIV. 0.7 zeros and 1 ml. That is the amount of fluid which is required to transmit hepatitis B. And hepatitis B need not be transmitted by just semen or vaginal secretion or blood. Even sweat as well as saliva as well as nasal secretions can transmit hepatitis B. And it can be transmitted via blood, it can be transmitted via the reproductive fluids, it can be also transmitted through food and water. So hepatitis B is also an important marker to be checked. And individuals also need to be checked for chlamydia. Chlamydia infection is also very common nowadays. So basically a man and a woman can get a premarital counseling done in which all these investigations or all these sexually transmitted infections will be covered.
So if someone wants to improve their sexual health, holistic sexual health,
Yeah.
what are the top 3 things that you would recommend?
It all starts with a person's mind. You have to be mentally open to deliver your best as well as mentally open to receive. And there should be realistic expectations between couples. This is where couple communication is very important. Couples should communicate well with each other, and everyone should tell their expectations to each other. And there should be no communication gap between couples. So this is where the sexual health starts. Sexual health starts with mental health as well as physical health. Couples should work out together. They should go to the gym or health club, or they should walk together. Regular physical activity is also very important. Couples should also keep a check on what their partner is eating, and the habits of their partners. Like if a person is smoking, the smoking should be quit. Alcohol should be consumed in moderation, and healthy food is very important. Okay. So it's a complete holistic well-being. Couples should be responsible for each other. Not only they should provide pleasure to each other, but they should also, limit, the man should limit a woman or a woman should limit a man if you feel that they are doing something which is harming their health, like smoking or lots of work related stress, which is, the man is pulling it home, and at home also there are multiple arguments because the man has left the office physically, but mentally he is still at the office. So these things need to be concerned. Also a healthy diet and good physical activity and spending good couple time together. So if these factors are taken care of, definitely the sexual health will be much better.
You spoke about office syndrome. Can office syndrome cause low sperm count?
Yes, definitely. And I'm glad that you asked this question, because office syndrome is a rising concern globally. Not only in India, but all over the world, because of the corporate atmosphere. Individuals, especially men, are in the office for, 12 to 14 hours continuously. They are under work pressure. They are surrounded by multiple electronic gadgets like laptops as well as Wi-Fi radiation. So the radiation from a laptop or the heat which is transferred to the body if the laptop is kept upon the legs and it is being worked on, and also the non-ionizing radiation from the Wi-Fi, all can lead to low sperm count. So basically they cause damage of the mitochondria of the sperms, and ultimately they cause sperm DNA damage, which will definitely affect the sperm count as well as the quality of the sperms in future. So office syndrome is a very important thing to be discussed, because office syndrome exposes the individual to radiation. It also increases the stress. And this stress is often carried back home when a man comes back home. So this low level of stress which the individual is working with, definitely it will increase the stress hormone in the body, which is called cortisol. As the cortisol increases, it may affect the quality of testosterone circulating in the body, or the testosterone which is in the body may not work on the testosterone receptors, or the receptors may become insensitive to testosterone. So all these factors will definitely lower the libido, lower the performance, as well as reduce the sperm count of the individual.
And stress is one of the top causes.
Definitely. Stress is definitely. So this is a chronic cycle. For example, an individual has to work on a particular project. He has a deadline 12 to 14 hours, even 16 hours, he's sitting in the office. The boss is yelling at him. He has his laptop on the lap. He's not able to focus. After some time, he goes near the window or he goes near the staircase. He smokes and he comes back. Or he has a cup of coffee and he comes back. Too much caffeine and too much nicotine. Nicotine as from cigarette smoke. That will cause basically sperm DNA damage. It is damaging the DNA of your sperms, and in the long term, definitely it will cause infertility. One more component of the office syndrome is delaying settlement in life or delaying pregnancy. So even if the couple is married and both the man and the woman, they are ambitious, a man may delay the pregnancy or delay family planning until he is in his late 30s or early 40s. A female may delay the pregnancy until she is around 32 or 35. Now what this does, because the quality of the sperms in a man when he is 20-year-old or 30-year-old is very different from the quality of a 35 or a 40-year-old man. The gradual reduction in the level of testosterone and the gradual decline in the sperm count or the gradual decline in the quality of the sperms, this happens once a man crosses 35 to 40. So basically, we have to treat this office syndrome by taking multiple breaks between works. Once the office is over, the man should be trained to leave the stress in the office and come back home. And negative habits such as smoking as well as excessive consumption of caffeine should be controlled.
And DNA damage, let's speak more about that. I think there's a test called DFQ, which male do during fertility treatments and all. So can you explain more about what kind of DNA damages?
See, nowadays multiple couples are going for DNA testing and genetic testing before pregnancy. Now these tests are not recommended for the average couple or normal couples. These tests are recommended only if there are multiple genetic anomalies in the family of the female or the man. If there is history of any abnormal childbirths or a childbirth with multiple cardiac anomalies, or some child was born who had multiple neurological disabilities, then we recommend these tests. We also recommend these tests if the couple have crossed a certain age. For example, if a man is 40 plus and is planning to start a family, or a female is 35 plus, then definitely we plan for these tests. Or if the couple has got multiple miscarriages, then we plan for these investigations. The basic investigation which we do before a man wants to start a family is a semen analysis, which a common man calls sperm testing. So a common question which my patients ask me is that how much should be my sperm count, doctor? So what I reply them is that the count alone is not important. We have to cover up multiple parameters. Okay, so these parameters have been laid down by the WHO or the World Health Organization, and what the WHO says is that the sperm count, whenever a man ejaculates, the volume should be between 2 to 2.5 ml, which is 2 to 2.5 ml of the ejaculate should come out. Every ml of the ejaculate should contain at least 15 ml sperms. The total volume of the ejaculate should contain about 40 to 45 million sperms. When the sperms are analyzed under a microscope, then at least 50% of the sperm should have normal physical characteristics or normal morphology. Out of those 50%, 40% should be moving forward. And the abnormal sperm should be less. So these are the parameters which we look into. So not only the number of sperms, but also the shape of the sperms, because the sperm has got different parts. Just like a human body has got different parts, the sperm has got a acromion, it has got a head, it has got a nucleus, it has got a body, and it has got a tail. Okay, so we count the number of sperms under the microscope. Then we assess each and every sperm, that how much percentage of the sperms are moving. Out of the percentage of sperms which are moving, how many are actively moving forward? So we need at least 40% of all the motile sperms to be moving forward. Then only the sperm will be able to reach the egg. Because whenever a man ejaculates, most of the ejaculate is deposited within the vagina. From the vagina, the sperm starts migrating. The liquefaction happens, the sperm starts migrating through the cervix into the uterus. Here the immunity of the female, it destroys more than half of the sperms. And once they travel, only one sperm will meet the egg within the tube and the fertilization will take place. Okay, so basically there is a huge competition between the sperms as well as the immunity of the female when a man is trying to impregnate the female. So multiple factors need to be considered.
By immunity of the female, you mean because it's a foreign body, the immunity
Exactly.
goes in and
Exactly.
tries to protect.
Exactly. So what we recommend is that you need to start planning 3 months before your wedding or 3 months before you start to plan a family. Smoking should be stopped. Excessive consumption of alcohol should be stopped. If you're overweight, try to lose some weight. Eat healthy, eat clean, start some physical activity like walking. Because any kind of physical activity, whether just going to the park for a brisk walk or doing some kind of body weight exercises at home or even joining a gym, all kinds of physical activity, they will boost your testosterone level. Once the testosterone level is boosted, you'll feel better, your reproductive health will be better, also your sperm count will improve. Plus, please start some supplements like coenzyme Q10, vitamin C, zinc, selenium, ashwagandha, as well as levoarginine with citrulline. Now, which supplement to start, how much to take, definitely your urologist or andrologist will let you know. So, premarital counseling at least 3 months prior is very important.
There are also other options available these days to couples like freezing of eggs.
Exactly. So, this is also very important because this initiative was initially started by Steve Jobs from Apple for the female employees. Because majority of the female employees who are working under him,
this was not known before Steve Jobs, or
it was known. He
just made it popular.
He made it. It became popular because the females who wanted to work and dedicate their time in the office and they wanted to delay their pregnancy to their mid-30s. When they were in the 20s, Jobs offered, ovum freezing. Ovum freezing for these females, which is freezing of the eggs for the females, so that when they try to start a family at 35, the quality of the egg will be the same as it is in their 20s. Similarly, many men nowadays are undergoing sperm freezing. So a man who is around 27, 28, he is not sure whether he wants to get married within a couple of years. He may delay his wedding until, he's 36, 37. So he may freeze his sperms. And then whenever these sperms are retrieved for IVF, the quality will be similar to the sperm in the 20s or the late 20s.
So what is the normal level of testosterone in the body?
So normal level of testosterone as it is, defined by the World Health Organization is 350 to 1000. Most of the Indian men, they have their testosterone, or a healthy young Indian man has between 600 to 700. Now, this testosterone level starts falling by 30 to 40% once a man hits 40. There are multiple factors, multiple causes, including aging, including free radical damage, including some lifestyle, like lots of stress in the work, or some environmental factors like smoking, which may promote to this. But it is easily recoverable with the help of natural supplements. First of all, we always start with natural supplements like fenugreek seed extract to boost the testosterone level, which often takes place within 4 to 6 months of consistent use. Secondly, there is also androgen replacement therapy which is available. Now, androgen replacement therapy, different forms of testosterone are available which have got different forms of half-lives. And it should be always given by a qualified urologist, andrologist or an endocrinologist. And it is always given in the office of the endocrinologist. In India, it is not legal that a person buys some hormonal products and he takes it home and he gives it himself. So it is not yet legalized in India. When it comes to TRT or testosterone replacement therapy, a complete body profile is done. And initially what we start is with a testosterone which has got a short half-life, about 7 days. So this is the initial start. And this is given as a intramuscular injection once every 7 days. We don't give it more than 100 mg. And we keep on controlling the cycle until we are confident that the individual is getting benefits and there are no side effects. Okay. Then once the individual is comfortable with this cycle, we carry on the cycle for 4 to 5 weeks and then we give a 2-week gap. During this 2-week gap, we give supplements to protect the liver. We also give supplements to reverse the estrogen effects, because whatever testosterone you are pumping into the body, ultimate end product is estrogen.
Yeah.
And estrogen may cause some undesirable side effects like change in the lipid profile, or increase in the cholesterol levels, increase in the chest fat, and so on. Okay, and there are multiple oral supplements also available, but the safest and the most recommended nowadays, what we do is that we prescribe testosterone gels. Now these gels, they contain a low quantity of testosterone, which can be applied on the shoulders and the upper chest. Now, why do I say shoulders and upper chest? Because this is the area of the body which contains maximum receptors for testosterone. And they can be applied every day, continuously. And your blood testosterone needs to be monitored. And your andrologist or your endocrinologist will give you on cycle and off cycle. On cycle where this gels will be on, and off cycle when you'll give your body rest and you'll allow it to replenish before the next cycle starts.
Why do some men go for enlargement of penis? You said the size, minimum size required is 2.5 centimeters.
No, that is the micro penis. We define micro penis because nowadays many people Google and they search online, and even boys who have a normal average size of the penis, they say that they have a micro penis. Micro penis is a stretched length of the penis is 2.5 centimeter. Definitely this kind of individual will require some amount of surgery, some kind of plastic surgery for reconstruction before he starts some family planning. But in general, what we see nowadays is the aromatization effect.
What is that?
Aromatization effect, because see, we do lots of campaigns for schools, lots of talks for schools, lots of checkups for school boys. So what I have seen in this generation is that whenever I walk into a classroom, every second or third bench, there is a obese boy sitting. Childhood obesity is rising in India, which is dangerous because see, whenever a child becomes obese, his hormonal profile is deranged. Also, peripheral body fat, the way a child stores fat, along the upper arms, along the chest, along the belly. So this peripheral body fat contains an enzyme which is called aromatase. And this aromatase cause aromatization effect, which is it will convert testosterone to estrogen. That's the reason why, young boys, it is very common to see them with, chest fat.
This
and
kind
with
of feminine characters.
Yeah, chest fat and belly is big and the penis and the testicles have shrunken in size. So this is mostly because of the aromatization effect. If these boys, they follow a healthy lifestyle, they take some healthy supplements and they lose weight, then definitely if they are able to achieve it before 16 or 17, then these effects are reversible. These effects are reversible, and when the boost of testosterone happens at around 17 and a half, 18 years old, the body will take care of itself. If the body is not able to take care of itself, then we may go ahead with some hormonal supplementation. Okay. Secondly, coming to penile implants. Penile implants, we do it. Majority of our patients are cancer survivors, whom we do penile implants for, especially men who have undergone extensive pelvic surgeries, or men who have undergone radical prostatectomy, or a robotic radical prostatectomy. Then, even if someone tries to preserve the nerves, which is supplying the penis to preserve the erectile function, nerve damage is very common because tumor clearance is our first priority. And if nerve damage happens, then the man may develop weak erections or erectile dysfunction. And nowadays, cancers are rising among younger men. So surgery is important to become tumor free. At the same time, quality of life is also very important once you're disease free.
That's a second priority.
Exactly. So for the quality of life, we do offer different kinds of implant devices. The most common ones is the Rigiflex implant. Rigiflex is something where, there are silicone cylinders which are implanted into the cavernosal spaces, and they are flexible ones. So the penis will continuously be in an erect state. And whenever the person is not having intercourse, the penis can be flexed and it will be flush with the abdominal cavity. It will be flush with the abdomen. Then whenever the man is using washroom, he can pull it down, urinate, or during intercourse, you can use it. And then again, he can conceal it. So this is, Rigiflex was a revolution because earlier rigid implants which were there, they were visible even after the man is wearing his underpants and his trousers, if the man used to wear tight trousers, it was visible externally, so it was embarrassing to some men. But with Rigiflex, the implant is concealed. Second type of implant which we offer is a 3-piece implant or a flexible implant or a inflatable implant. In this implant, there is a saline chamber, there is a pump, and there are 2 cylinders within the cavernosal spaces. When a man wants to have an erection, he uses the pump, the saline fills the cylinders.
Which is placed behind the penis?
Yeah, so the cylinders are within the cavernosal spaces, the reservoir is behind the pubic symphysis, and the pump is in the scrotum, which is just above the testicles. So entire thing is concealed. So whenever the pump is applied, the man achieves an erection.
It's like they have to press.
Yes. Okay. Yes. And after the act of intercourse is over, there is a release button concealed. He presses the release button, the saline returns back to the chambers, and the erection is gone. So these kind of implants, the person needs to be intelligent. He needs to come for regular follow-ups. He needs to avoid violent or aggressive sexual activities, because these cylinders can burst, and if they burst, the implant needs to be removed immediately. Okay, so the patient compliance, the expectations of the patient, as well as the duration of time the patient wants the implant. For example, in Indian patients, very often I have seen that the person was enthusiastic, got an implant, lived a nice healthy sex life for about 4 to 5 years, and 5 years later, he doesn't want the implant anymore. He's fed up of the implant. So after the removal of the implant, the normal erection or the normal physiological erection may be lost. Because the cavernosal spaces are dilated, the natural blood supply, the tracts are damaged during the placement. So after removing the implant, the natural erection which a man expects, that he got an implant done, he enjoyed the implant, and after removing the implant he expects a normal erection which happened. So that is not possible. Yeah.
So thank you, doctor, for explaining these issues with such clarity. It was super informative, rarely spoken about. Thank you so much.
Yeah, thank you
for coming onto the show.
Thank you.